This is an ultrasound study of a 16 years old young male with a history of vomiting for the last few weeks. He has been taking medication with no relief. Now the image freezed in front of you shows on the right side that this is the liver and this is the transverse section of the kidney, right kidney. And these are the hilar region vessels. This is the right renal vein and this is the right renal artery. Now this image is specially focused to see the patency of the right renal vein as well as the right renal artery. Now above is the right renal vein and below is the right renal artery. And both are patent, especially the right renal artery is important that this is patent. It shows patency. And the size of the kidney is 3.9, which is within normal, up to 5 is normal. Now this is regarding the study of the hilar region of the vessels in a patient with renal parenchymal disease. Now I want to show you, let's study it step by step and see the status of the kidney in this young boy, and you will see that let's study the findings one by one before. And I tell you one thing, as a routine, I do not have any lab profile or any other imaging modality facility with me, not been provided, so it has to be done on your own. The length of the kidney is 8.7, it's within normal. Anterior posterior diameter is 3.5, it's within normal. Now next thing that we study, लंबा सांस बेटा लेके सांस रोक लो. बेटा लंबा सांस लेके सांस रोको. Now the second important thing to study is the parenchyma. The parenchyma includes of the cortex and the medulla. Now in this you can see this is the parenchyma, anterior parenchyma. The echogenicity of the parenchyma should be equal to that of the liver or less than that of the liver parenchyma. Now in this kidney, the parenchymal echogenicity of the kidney is diffusely raised, and this goes in favor of renal pathology. Now for this, the condition is that the liver should be normal. If the liver is not, if the liver itself shows decreased echogenicity, or its echogenicity has gone down because of some pathology, any pathology, let's say CCF, hepatitis, etc., then you will also see the kidney parenchyma echogenicity raised as compared to that of the liver. So, and that will be because of the adjacent diffuse decreased liver parenchymal changes. Now in this case, the liver is normal, the diaphragm is okay, right diaphragm is showing no fluid about the diaphragm in this scanning plan, and then we see that the echogenicity of the parenchyma is raised in this angle. This is the liver and this is the right kidney. This is point number 2. Then we study the cortex and medulla. Now you see this is the medulla, this is the medulla, this is the medulla. Parenchyma consists of cortex. This area, this rim of echogenic tissue is cortex. This is the medulla. Now the cortical thickness at the anterior mid region is approximately 6.2 and is within normal. When you have to take the measurement of the now this is the cortical measurement only, but if you have to take the parenchymal echogenicity, then you will have to include the pyramid within it, and it is about 15.7, and this is within normal. So the parenchymal thickness is normal. What we have seen so far, number one, the echogenicity of the kidney is raised diffusely, number one, and secondly, second point that we see is that there is no central sinus echo complex fat seen. This is the area where you see the collecting system or the central sinus echo complex fat. It's absent in this patient. There's no fat seen. Rather, there is minimal, mild fluid within it. This is the second point. In this third, you see that how prominent the pyramids are. Normally, you don't see pyramids to be so prominent as we are seeing in this patient. Pyramids are quite significant, prominent. This is the pyramid, this is the pyramid, this is the pyramid. And again now this is the pyramid, this is the pyramid, this is the lower portion. And then I showed you in a transfer section that then we see that in transfer section the artery, the renal artery, this is the renal artery, is patent. The right renal vein is of normal caliber, no clot or thrombus seen. And in transfer section, if I magnify a bit, no, let me keep it there. So, this is how we study. There is no focal seen. No, this is the upper pole, no adrenal region pathology seen, no calculus seen, no significant hyponephrosis seen. The proximal ureter is not dilated. This is now, if you want to study the proximal ureter, it is not dilated. Now this is the right renal artery from a different angle. This is the IVC, this is the aorta, this is the right renal artery transfer section. When I move the probe 90 degrees, you will see it entering the hilum of the kidney. Here you are. This is the hilum of the kidney. This is the kidney with obscured view. This is the right renal artery. Follow it downwards and angle the probe below the subcostal margin, and you get the same image: IVC, aorta, and the right renal artery. Now, what is the status of the left kidney is also important to be seen, and you will study the right kidney in the same way as we saw. Normal, passa melhor better. Now you see that the right kidney also shows almost all the same changes that you have seen in the right kidney. See the prominence of the pillar. First of all, the size is normal in length, 7.7, relatively small size, 4.3 in anteroposterior diameter, diffuse, increased parenchymal echogenicity. Pyramids are prominent, no central sinus echo complex, no focal vein, no calculus seen. So this case is very much consistent with bilateral renal parenchymal changes, and interstitial nephritis cannot be ruled out in this patient. If you want to study the hilar region in this kidney, then now one thing more, that there is no dilation of the proximal ureter seen, and this is the hilar region of the kidney, this one. Not a clear view. Let me give you a clear view. Beta सीधे हो जाओ. बस किसको मेरे किसको. Thank you. Left kidney is always difficult to study, because of its location. I'm not getting it properly. So once again I'll try from this angle. Pass over. This is the longitudinal section. I will give a 90-degree sweep, and here we will come towards the hilar region. This is the hilar region vessel. These are the hilar region vessels which are patent. So this is how we study the kidney, and in this case it can be a case of UTI, it can be a case of interstitial nephritis, it can be a case of glomerulonephritis as well. So further investigations are required to reach the cause. I will suffice with the sonographic findings in this case. Thank you very much. This is regarding the ultrasound study for comparison purpose with the pathological kidney with parenchymal changes that I showed you. Now you see that ask the patient to take a deep breath, hold it, लंबा सांस लो बेटा, सांस लो जोर से, रोको, and then freeze the image. Okay, solid. Measure the kidney, 9.5 centimeter in length, 3.4 centimeter in anterior posterior diameter. The measurement is okay. This is the irisource muscle force on which the kidney glides with respiration. Now, next thing to study is that what is the echogenicity of the parenchyma. Now here you can see that the parenchymal echogenicity of the renal parenchyma is less as compared to the normal liver. This is the normal liver, and you compare the echogenicity. This is the normal echogenicity, as it should be equal to or less than the liver, and when it is so, we say that the renal parenchymal echogenicity is normal. Now the cortex, this area, so it is strip. This area is the cortex, and these are the medulla. Now, for cortical thickness 5.2, for parenchymal you have to include the pyramid with it, 12.1. So the cortex and the parenchymal thickness is intact. Similarly, you can see that this is echogenic area. This is the central sinus epicomplex which was absent in that patient. This is the fat. This is the area where hydronephrosis occurs, where calculi are seen if they are present. Pores are clear, no focal mass lesion seen, and thus this is. Now turn the kidney toward 90 degrees, you will get the hilar region and study the hilar region. You can see vessels, patency of the vessels. Here you can see that. This is the hilar region, this is the transverse section of the right kidney. Measures 4.4 is within normal, and thus this is a normal study. This is echogenic area, is suggestive of central sinus epicomplex, and that we did not see in the patient with renal parenchymal changes. Thank you very much.